friends, today we are going to discuss about the rabies part 2. In the first lecture, we have discussed about the rabies disease and their signs and symptoms. But in that lecture, we are going to focus on what are the diagnostic method and what are the treatment plans which are available for this disease. So as for the diagnostic method are concerned, there's basically two types of methods. First is a demonstration of rabies virus antigen by immunofluorescence. This is the most commonly used method around the world, and another method is a demonstration of inclusion bodies. In that that method is usually applies when there's an unavailability of the immunofluorescence and the other biological tests. As far as the prophylaxis is concerned, we can divide that in two types. Prophylaxis means that action taken to prevent the disease. Okay, so there's two types. First is a pre-exposure and then is a post-exposure. In pre-exposure, this vaccine is recommended to all the animals, but when it comes to the human beings, we are not recommending to everybody. That vaccine can be used only for the people who are working in high danger areas, that is around the animals where there is a considered to be high risk of that disease. Example, the veterinary doctors and the dog handlers. However, this vaccine contains certain adverse effects, so that's why it is recommended that it is not be used by every. But after the evolution of the cell culture vaccine, this risk has been totally gone, and this is a safe and feasible vaccine for as well as the human beings are concerned. And in the post-exposure to the vaccine, once the rabbit dog bite and the wound, and in the wound there's a virus collected, the first treatment you have to do is to scrub the wound where the virus or where the blood is coming, or where there's a scratches there. You have to scrub with the soap and water for around 25 to 30 minutes, and afterwards you have to apply some disinfectant like quaternary ammonium compounds, as well as you can also apply alcohol with a range of 40 to 70%. And in a severe wounds, we should also recommend that the people or the patient get anti-rabies serum vaccine, and it is recommended that we have to postpone the suturing part because it may be get sepsis. And if necessary, we have to provide some anti-tetanus injections as well as antibiotics, so that the sepsis or other sort of infection would be prevented. As far as the rabies vaccine is concerned, there's basically two types. First, a neural, and then another one is a non-neural. The rabies vaccine is considered not very safe to the human beings because it contains certain adverse effect from minor to severe neuroparalytic complications. But however, as I told you before, that after the commencement of or after the evolution of the cell culture vaccine, this risk is subside. If we talk about the cell culture vaccine, this is considered to be the most safe and feasible vaccine for the human beings, and it is considered to be it is put into the two categories. First is the pre-exposure and the post-exposure. In pre-exposure, we can give to the patients or the people who are in a high range of danger, who are working with the animals like doctors and dog handlers. As I told you before, there's 3 doses for them. One is for once on the 0 day, and afterwards it on the 7th day, and then 21st day. Afterwards, after a year, you have to give a booster dose, and after 5 years, you have to give the booster dose as well. It is recommended. As far as the post-exposure is concerned, there's 5 doses for this vaccine. First is on the 0 day, then 3rd day, 7th day, 14th, and then on 30 day. And afterwards, once the vaccination course has been completed, the patient is protective for at least 5 years. And during that period, if there's a further exposure, the patient should have to get one or two doses, not the complete course. But after the 5 years, the patient have to again get the complete course, that is for the complete 5 doses to prevent the spreading of that disease. As far as the treatment is concerned, it is demonstrated that there could be there. As far as the treatment is concerned, it is demonstrated that there's a full recovery of the patient by intense supportive care and the management of the complications. Uh, Rabies is endemic in developing countries like India. In India, at least 30,000 people die every year because of this rabies disease, and around more than 70,000 people get anti-rabies vaccine. So this is for now, and in the next lecture, we will go ahead and choose some other topic or any other disease. For then, thank you and bye-bye.